Yeah, thank you.
Hey, if you haven't heard, my co-host is going to be having some minor surgery in a few weeks.
Yes, minor surgery. I'm getting LASIK.
Okay.
Whenever I say that, I feel like I have to make my eyes really big.
Okay.
LASIK. And I'm finally ditching my glasses, my contacts that I put in every day, and I'm having the surgery performed live on the show. I'm a little nervous.
February 23rd,
yeah,
2 weeks from today.
So if you're like me and you can't see much without glasses or contacts and it drives you crazy, you can understand how amazing LASIK sounds. Can you see?
I can't see it. I can't see it.
But also, it's, you know, it's a little worrisome. You're going to lay there, and it's the thing that I get nervous about is that when I am undergoing any sort of medical procedure, I like to close my eyes.
That's not going to work too well here.
It doesn't go over well when you're getting LASIK and when your eyes are going to be under a laser beam.
I think so, no.
Yeah, so I got some answers about the process from the doctor that's going to be doing my surgery. If you have questions, you got to watch.
Patients are always commenting, you seem to love your job. And it's because every day after surgery is like Christmas morning for me. I get to see these patients. I walk in the room, they're smiling, they're happy, and they say, I saw my alarm clock for the first time in 30 years yesterday.
Dr. Lobanoff has been performing LASIK surgeries for 9 years, and if you don't know much about it, the thought of eye surgery might creep you out a little bit. But Dr. Lobanoff says not to worry.
And although it sounds a little scary, it's actually completely painless and very well orchestrated.
And the payoff is huge.
The average person is going to see tremendous improvement in their vision without glasses or contacts. And usually we can at least match what they had with their glasses or contacts. Very often we can exceed that. And particularly with the new custom Xywave technology, we can actually get a lot of patients into the 2015 and some into the 2010 range, almost twice as good as 2020.
That's so cool. If you're wearing glasses or contacts now and 20/20 vision without them sounds good to you, picking a doctor is your next step.
The old adage, you get what you pay for. There are some centers that will advertise something like $500 per eye. And unfortunately, this is a bit of a bait and switch scheme. So patients come in excited about this low price, and then they realize that the price is elevated once they get there. Very few people, almost no one, get that low price. Starting off a relationship with a patient where you're being a little dishonest with them is probably not the best approach. If you can, try to find a surgeon that has advanced training in LASIK. Most LASIK surgeons will conduct just a 2-day training course to be certified to use the laser, but there are a few of us that have actually gone the extra mile, done a year-long fellowship in LASIK surgery. And if you are a little bit more nervous, finding one of those LASIK surgery fellowship trained surgeons, that's just one more level of confidence you can have in their abilities.
And if you're like me and you've been wearing glasses or contacts for years, going from blurry to clear in a matter of minutes sounds pretty unbelievable.
This is something that patients benefit from literally every second of the day for the rest of their lives. Not having to worry about putting on glasses or contacts, not having to worry about fogging of vision if they go outside on a cold Minnesota day. They really appreciate the little things in life a lot more.
Oh, it's so exciting. Now, I did ask Dr. Lobanoff one question. I said, how many people have left blind? He said 0.
0.
Yeah,
okay.
so I'm ready to go.
That's good.
Ready to go.
Good.
So you can find Dr. Lobanoff at North Suburban Eye Specialist. He's been so great to work with. He's a great surgeon, and you meet him before you go into surgery. Yeah. A lot of places you don't. You meet him, not just me, everybody does. And he's going to be here in studio next week to answer some of your questions about LASIK. So if you want to send us your questions, we'd love to get them. Go to KSTP.com, click on Twin Cities Live, and check out the live LASIK page on our website.
That's good. I think a lot of people are going to have some questions. And at the end of the month, February 23rd, actually, you're going to remember to watch because Elizabeth is going to get LASIK right here on the show. You're going to see the whole thing, start to finish. We're going to watch my eyeball be cut open. What? No, easy, dude. Yeah, easy. You are. It's going to be great. Okay, coming up, find out if